When you bathe your baby, make sure you are using lukewarm, not hot water. Hot water tends to increase the evaporation of moisture from baby's skin, increasing the chances that your baby will deal with dry and itchy skin. Also, when you bathe your baby, if he or she is actively dealing with dry patches, you may want to add a pinch of salt to your baby's bath water. Or if you have oatmeal, go ahead and put a little oatmeal in the bath water. What that does is help to calm the itchiness and soothe your baby's skin. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi. If this is your first time here, you are most welcome. Make sure you look around at some of the other videos that have already been uploaded, as I am certain that they may address your concerns or answer your questions. Also, do not fail to hit the subscribe button and join this growing community of empowered learners who are active participants in their own health care. As you can tell by today's title, I will be addressing eczema. As a matter of fact, for the next few videos, I will be addressing conditions that are frequently seen in newborns and in infants. So make sure you click the subscribe button if this is something that you are interested in learning about. Now, before I jump into today's video, it is very important to state that moms and dads should work very closely with health providers who are well versed in your or your baby's health history, so that when a plan of care is created, it addresses your child's specific needs. And without further ado, let's jump right in. So what exactly is eczema? Well, eczema is a condition that causes baby skin to be more dry, itchy, and inflamed than is typically seen in newborn or in infant skin. It is a fairly common health condition affecting 1 in 5 or approximately 20% of all babies. Now, it is more commonly seen in African American babies or babies of African descent and in Asian populations than it is seen in people such as Caucasians or people of other backgrounds. And although the exact cause of eczema is not known, experts tend to believe that it is a combination of an individual's genetic information and their environmental factors that combine to determine if and how severe an individual would deal with eczema. Now, as previously mentioned, eczema shows up as itchy, dry skin, and it's usually scaly to the touch. So if you rub it, you can see some flakes fall from it. And eczema can appear anywhere on a baby's skin. That includes their cheeks, on their chin, on their nose, in the folds of their hand, or in the folds behind their knees. But it can show up anywhere on your baby's body. These patches are very rough to the touch, and in lighter skinned babies tend to be reddish in appearance, but in darker skinned babies can be grayish or silverish, but they are both still very hard to the touch. There are some reasons why babies are at higher risk for dealing with eczema than adults or even some other babies, and that includes that babies have immature skin and they also have poor temperature regulation. Also, some babies have larger pores than others, causing them to lose moisture or water more quickly out of their pores than is typical. And with more water evaporating quickly off the skin, those baby skins tend to be prone to dryness and scaling. Babies with larger pores also have an increased risk of dirt, debris, bacteria, and other germs gaining easier access into their skin, increasing the likelihood of inflammation and dryness. Now, there are several things that parents or caregivers can do to help manage or even prevent the breakout of eczema in babies. When you bathe your baby, make sure you are using lukewarm, not hot water. Hot water tends to increase the evaporation of moisture from baby's skin, increasing the chances that your baby will deal with dry and itchy skin. Also, when you bathe your baby, if he or she is actively dealing with dry patches, you may want to add a pinch of salt to your baby's bath water. Or if you have oatmeal, go ahead and put a little oatmeal in the bath water. What that does is help to calm the itchiness and soothe your baby's skin. Also, make sure that you do not use soaps such as, heavily perfumed soaps that contain dye or anything of that sort that can irritate your baby's skin. My toddler deals with eczema, so when I bathe her, I use Baby Dove sensitive skincare, and that is a very rich moisture soap that is also very hypoallergenic to help manage eczema in my baby. Once your baby is done bathing, you want to make sure that him or her is lotioned within a few minutes after the bath. Do not allow their skin to dry out, because once the skin dries out, now you have to re-moisturize it. So soon after your baby is bathed, make sure that you pat him or her dry. Don't rub, because rubbing can irritate the skin. And then you want to follow your baby's mild soap with a mild lotion. I also use Dove body lotion for my baby. Now, it is recommended for you to apply lotion to your baby multiple times during the day, just to ensure that a good level of moisture is maintained in your baby's skin, to kind of keep that dryness away that can eventually lead to eczema. Another thing that parents and caregivers can do to either help prevent or manage the breakout of eczema is to be very careful the type of fabric you dress your baby in. Believe it or not, if you dress your baby in polyester or wool, this increases the likelihood of itchiness and irritation on your baby's skin. And these itchiness can lead to inflammation and eczema breakouts. Instead, dress your baby in cotton and make sure that the cotton is nice and breathable so that your baby's skin can be properly ventilated. Also, before you put any newly purchased clothes on your baby, make sure you wash them first. You don't know whether these clothes have fallen on the floor or whether they were properly handled in the factory. So before you dress your baby in them, make sure they are clean as possible. And while I am talking about cleaning your baby's fabric, make sure that you are using very sensitive soap to wash your baby's clothes. For my child, I use All Free and Clear, and this type of soap is very good. It's a very good choice for washing your baby's clothes because it is hypoallergenic. Once you've washed your baby's clothes in soap that will not irritate his or her skin, if you choose to use a fabric softener, make sure you follow with fabric softener that's also free of any dyes or perfumes or anything that can cause irritation in your baby's skin. You want to use soap that is as close to pure water as possible so that your baby's chances of developing those outbreaks are minimized. Now, if you recall, in the beginning of this video, I mentioned that environmental factors can come into play to decide whether your baby will have eczema breakouts. So one of the things you want to do is kind of control the environment that your baby is in. You want to keep your baby's space cool, not cold. Cold tends to dry out the skin, but cool tends to limit the amount of evaporation of sweat from your baby's skin, helping your baby to stay nice and moist. Now, you also want to make sure that you use a humidifier around the space where your baby sleeps. Make sure you clean that humidifier frequently so that germs and other nasty things don't build up in it that can further affect your baby's skin. Also, you want to make sure that when your baby is sleeping, that you do not use heavy blankets or comforters on your baby, increasing the chances of your child sweating. Put a nice comfortable pajamas on your baby and lay him or her to sleep in a nice cool room so that your baby retains as much moisture as possible and keeps their skin from breaking out. Now, eczema can cause very severe itching, so you want to make sure you limit your baby's scratching as much as possible. To do this, make sure you clip your baby's nail and keep them nice and short. Also, make sure you keep your baby's nail bed clean so that bacteria and other debris do not hide in there and get into your baby's skin if he or she does scratch. You also want to make sure that you are, like I previously mentioned, applying lotion during the day so that your baby's skin stays nice and moisturized and supple. It is also very important to limit the amount of stress that your baby is dealing with. Stress causes inflammation, and if your baby's skin becomes inflamed, he or she is going to scratch it, and those eczema bumps are going to start showing up all over your baby's body. And then it can, one thing can just feed another and increase the likelihood that your baby will have a severe outbreak. So if you limit the amount of stress your baby deals with by creating a schedule and keeping your baby on a steady schedule, you limit how much your baby deals with stress-induced eczema. You also want to avoid the use of alcohol-based products like hand sanitizer or alcohol swabs or things of that sort. And this is because alcohol has a very drying effect on skin. Once the skin is dried or rubbed with alcohol, it increases the likelihood of irritation, and that irritation can lead to breakout of eczema in your baby. It is very important for parents and caregivers of babies with eczema to protect these babies. These babies have larger pores than typical, making them more prone to infection than other babies. Therefore, if you have somebody who is sick trying to come visit, tell him or her to reschedule their visit. And when you have individuals come visit your baby, make sure that they observe hand hygiene by washing their hands with soap and water for at least 30 seconds. Make sure they wear a mask to limit the chances of passing any kind of unknown infection to your baby. And if your guest plans to hold your baby, make sure you provide a receiving blanket so that you can use it as a barrier between this guest and your baby to block your baby from any perfumes or dyes that this individual may have on, but also decrease the likelihood of skin irritation from fabrics that may not be cotton that the individual may be wearing, or any pathogens which are disease-causing things that this individual may carry and not be aware of. Now, if you have followed the advice in this video, video and your baby's eczema breakouts still persist, it is now time to take your baby in to see a pediatrician or a doctor who specializes in skincare. These specialists can provide a cream or some kind of relieving emollient that you can apply to your baby's skin, such as a corticosteroid, to help calm and soothe the itching and kind of stop the inflammation process so that your baby's skin can heal. I hope that you have found value in the content of this video. If you have, do not fail to give it a huge thumbs up and then hit the subscribe button and turn your notification bell so that you are made aware of every time a new video is uploaded. If you know somebody who can benefit from the content of this video, do not fail to share this with them. Come along with me as we build this community of empowered learners who are active participants in their own healthcare. And until the next time, I wish your baby sound health and I wish you excellent care provision. Y'all be blessed.